Welcome to the deep dive. Today we're tackling something that honestly had us scratching our heads for a bit, thanks to listener Kensu. It's about vitamin B complex.
That's right. Kentu pointed out two research papers on B vitamins and kidney disease that seem to say, well, completely different things.
Yeah, one basically suggesting they're harmful for kidneys, the other saying they're helpful, so bit confusing, right?
Definitely. So our mission today is to, unpack these findings, maybe debunk a myth or two about B vitamins along the way.
And really show you how critical thinking applies even here, especially with health claims.
Exactly. It's all about looking deeper.
Okay, so let's lay out the puzzle. We've got this 2010 study, right, on diabetic nephropathy, that's kidney damage from diabetes. And it found high-dose B vitamins actually led to worse kidney function. They measured the GFR, the glomerular filtration rate.
Which is basically how well your kidneys are cleaning your blood.
Right, and it showed a drop in GFR plus more vascular events. Not good.
Not good at all. But then you have the 2020 study.
Yeah, looking at kids with early diabetic kidney disease. And that one suggested B complex could be safe and maybe even effective.
So, yeah, what gives? How can both be right?
Well, you hinted at it. The key might be in that term, vitamin B complex.
Bingo. It sounds like one thing, but it's really a group name for 8 totally different vitamins. B1, B2, B3, B5, B6, B7, B9, B12.
8 distinct members of the family doing different jobs?
Exactly. And, lots of products, even these studies, use the B complex label, but only include like a few of them.
Okay. So the 2010 study, the one showing harm?
That one used B6, B9, and B12, high doses.
And the 2020 study, the one suggesting benefits in kids?
That focused on B1, B6, and B12. See the difference? B9 wasn't the focus there in the same way.
Okay, that's interesting. And this links to another point, right? The idea that B vitamins are totally safe because they're water soluble.
Yeah, that common belief that you just, pee out any excess.
It's not quite that simple, is it?
Not always. The sources show it's a bit of a myth. There are documented toxicities, especially at high doses. B3 can cause flushing. B6 nerve issues.
But B9 seems really central here, especially for Kensu's question about kidneys.
Right. B9, often called folic acid. And that name itself hides a crucial split.
Okay.
There are two forms. Folate is the natural one in foods, like leafy greens. That's generally good stuff. But folic acid, that's the synthetic version you find in many supplements and fortified foods.
And that's the one that can be problematic.
Potentially, yes.
Okay.
Especially in high doses. Get this. High-dose synthetic folic acid is actually used in labs to induce kidney damage in animal models.
Wait, really? They use it to cause the problem they're studying?
Yeah, because it's known to be a kidney toxin in those amounts. It's pretty direct.
Wow. That really changes how you look at a supplement label, doesn't it?
It certainly makes you think. So when we look back at the research on B9 and kidney health...
Let me guess. They mostly use the synthetic folic acid?
You got it. Almost exclusively. A 2012 review basically said folic acid treatments shouldn't be used for cardiovascular protection in kidney patients.
Okay.
Then a 2013 report, same story. Folic acid, B6, and B12 supplements didn't help with mortality or heart complications in chronic kidney disease.
And there was another one, 2016?
Yep. Found folic acid didn't cut heart attack or stroke risk in those patients either.
But then there's a twist, right? With the natural form.
Exactly. A recent 2024 study flipped the script slightly. It showed that higher dietary folate, the natural stuff from food, was linked to a lower risk of death in end-stage kidney disease.
But the synthetic folic acid from fortified foods?
No benefit seen there in that study.
So, okay, let's circle back to Kensu's original question. The two papers seemed contradictory.
But they aren't really once you unpack the specifics. The evidence points pretty clearly now. B-complex supplements, especially those with synthetic folic acid, don't seem to help kidney disease patients and might even be harmful, like that 2010 study suggested.
But getting natural folate from your diet, that could actually be beneficial.
It seems that way, yes. So the contradiction dissolves when you look at which B vitamins and, crucially, which form of B9.
So the big takeaway for you listening, it's all about the details, isn't it?
Absolutely. What looks simple on the surface, like vitamin B complex, can be incredibly nuanced.
And the source matters hugely. Natural food versus a synthetic supplement can lead to, well, opposite outcomes for your health, particularly with something as important as your kidneys.
It really underscores that need for critical thinking, doesn't it? Question the broad labels, understand the specifics, look beyond the headlines.
Knowledge is one thing, but applying it, understanding the why behind it, that's where the real value is.
I agree more.
So here's something for you to mull over. We've seen how B complex isn't simple. How often do we see these kinds of broad categories used in health advice, maybe hiding really important distinctions? Think about things like fats or even exercise. What other seemingly simple labels might be worth a deeper dive for your own well-being?